Unical Radio International, Entertainment 360, Edutainment 360, Infotainment 360. We smile like that.
Well, good evening, listeners. It's another Wednesday, and it's ABC of Health with Dr. Thelma. It's so good to be on air with you. How are you? I hope you've had a very great afternoon. I've had a busy day as well. So you're welcome to the show today, and we have a very interesting topic today. It's something that everybody's got to talk about and join in the conversation. The theme of today's show is love is not enough. I'm sure everybody will be wondering, like, what's she talking about? Is it a relationship tip? Is it a relationship show today? No, it's not. It's about your health. Yes, love is truly not enough. So today we'll be talking about the heartbreak of sickle cell disease. We're going to be talking about the entity sickle cell disease. Like we already said, we're going to be talking about love is not enough. And no, it's not a relationship tip show. We're talking about your health, and we're talking about sickle cell disease. So with me in the studio, I have Dr. Ofonime Essien. She's a consultant hematologist with the University of Calabar, Teaching Hospital Calabar. You're welcome.
Thank you very much, hello listeners.
All right. And then I also have Miss Deborah Ononokpono. She's the founder, Calabar Sickle Cell Foundation, and she's our guest on the show. Miss Deborah, you are welcome.
Thank you very much.
All right. Okay, so we're going to go right into it and start off. So we're going to start with Dr. Ofonime. Please, can you tell us exactly what is sickle cell disease?
Thank you. Sickle cell disease is a disease, as the name as it said, and it's any disease that has the abnormal hemoglobin S. That's a sickle hemoglobin S. The hemoglobin S is normal. We have two types of hemoglobin S. We have that's AA. So we have hemoglobin F, hemoglobin AA. So the abnormal, it has abnormal hemoglobin S. So that anything, all the traits, the disorders are all sickle cell disease. It's an umbrella name. But we have different variations of sickle cell anemia, sickle cell traits, those are, but they are under the umbrella name of sickle cell disease.
Okay. So all of them are called sickle cell disease, but they are different. You have the sickle cell anemia, the sickle cell traits.
Yes.
Can you please explain what the different ones mean in simplest terms possible?
Okay, for the sickle cell anemia, is when we have homozygous, that's the same, or two hemoglobin SS. Like you keep hearing people say hemoglobin SS or SS.
Okay.
SS. That's what we call sickle cell anemia, and has a worse outcome.
Okay.
But the sickle cell trait is AS.
Okay.
So therefore, since it has an S,
yeah,
it makes it a sickle cell disease.
Okay.
So all of us are AS all have sickle cell disease.
Okay.
But we have traits.
We just have the traits
of it, yes.
Okay. Good. All right. Thank you very much. That makes a lot of sense now. So those that have the SS are the sickle cell anemia.
Yes, the two.
Yeah. So SS. So okay. So AS are those that have just the trait, but all of them have sickle cell disease. Okay. Wonderful. All right. What are the other blood genotypes that people have apart from the AS and SS? What else is there?
We have the SC.
Okay.
We have the SD. We have the SO Arab.
Okay.
We have the Panju. So we have different types, but the commonest in, well, like call it in Nigeria and Africa, is the SS and the SC.
Okay.
We have the beta thal, where we have the thalassemia and the S together, like sickle cell.
Yeah.
Thalassemia is also another disease.
On its own.
Yes, but when they come together, they also give the type of the sickle cell disease.
All right. Okay. Thank you. All right. That's good for an introduction. Now, so I want to ask. I have a follow-up question. How common is sickle cell disease? Okay. Now, for the purpose of this show, now that you have aligned us, we are going to be talking about the sickle cell anemia, because the people that have the traits really will not have the things that we are looking out for today. However, somewhere they're going to feature, but for today we're going to stick with the sickle cell anemia. That's the SS. Okay. So how common is sickle cell anemia? How common is it?
Well, sickle cell anemia is quite common. You know, parents are coming out and bringing out their children. In those days, parents used to hide their children, so you couldn't really have a good prevalence. But in Nigeria, we have a prevalence of 1 to 3%.
Okay.
In Calabar, a study was done by Calabar, and so we have 2.8% in Cross River State of sickle cell anemia patients. So you see, it's quite common. It's not as rare as we thought.
Yeah.
Even in sub-Saharan Africa, Nigeria has the highest burden of sickle cell anemia.
Okay.
So it's really common. And it's even said that about 300,000 newborn babies are born per year.
With sickle cell anemia.
Yes. So if you calculate that per year, how many years have passed, you know we have a lot in our hands.
Wow. Okay. Now, on this show, we are privileged to have a warrior. I call her a warrior because she's currently living with sickle cell anemia. So I'm going to come to her when we've gone a bit further with some of most of the medical things. So you're going to say that. But Deborah is going to come and she's going to tell us how it has been. She's the life wire of today's show. So we're not talking about textbook. We have someone with us that's living with it. So she's going to be in that space very soon. But before then, we are going to get enough information about it. So when people listen to her, they would actually understand, not a joke. They know what she's passing through and what she's living with. She's going to be like a hero of today's show. Okay. So now I'm going to ask, I actually, when I was, I think, a house officer, and a woman brought her baby that was sick, a young child, I think a toddler or so. And then later the hematologist came and said this child has sickle cell anemia. The woman went into a frenzy and started accusing a hospital that the child was sick and got transfused. That it was in that hospital that the blood they put the child, that they gave the child sickle cell. And it dawned on me that there might be a group of people who think that this can actually be transmissible from blood transfusion. So please, Dr. Ofonime, can it be gotten? How can one get, in essence, the question is, how can one get sickle cell anemia? And can it be gotten through blood transfusion?
Thank you for your question. And that's clarifying a myth.
Yeah.
Sickle cell disease or anemia cannot be gotten from blood transfusion. It cannot be gotten from blood transfusion. It is an inherited disease. That is from your father and from your mother that you have it. So both parents have to have the sickled gene, hemoglobin AS, hemoglobin AS. When they get married, through the Mendelian law, I'm trying to be, this is also is a little bit more than, so through the Mendelian law, you found that a child, 1 in 4 will have that sickle cell disease, that's the hemoglobin SS. You can have 2 that will have AS. So it's an inherited disease. Both the parents give the children. It's not through blood, it's not through sex, in quotes, but it's through inherited from your parents. So that's why we say genetic, that marital counseling is always important.
So it's not also a spiritual problem?
No, it's not a spiritual problem. They are not Obanjis. They don't come and die and go. Oh, man,
because I was just about to ask, because another school of thought says they are whatever that means. They come, they stay, they go, and they keep coming and going. So in essence, these parents just keep bringing the same set of children.
The same gene.
Yes, it's the same gene. So they come and they don't survive, maybe because of course, the obvious. We're going to hear it all very soon. Okay. All right. Okay. Let me go to Deborah now. Deborah, we'll be going back and forth. We'll talk to you a bit and then we'll come back to Dr. Ofonime. So we balance the table. Deborah, please, can you tell us, at what age did you know about sickle cell disease and at least know that this is what you have?
Thank you very much. Well, I was kind of opportune to have exposed parents. So I'm sure they did all the running around and didn't really let us know. Why I'm saying us is because in the family of 6, 4 of us had sickle cell anemia and we were doing very well. So it was in my SS1 when I lost my mom that it dawned on me that something was wrong with me. What is wrong with me and how can I continue this care on my own? So it was in my SS1, the student nurse and counselor back then in the boarding house had to explain to me what I was living with and how I got it and what can be done. So I started researching and working on it just to stay healthy.
Well, that's a tough one. Okay, Now, how have you lived through crisis? You know, this. I hope the word crisis is still in use. Good. And that is the series of how do we put it? Pain that comes with people that have sickle cell disease. How, or sickle cell anemia, how have you been able from your childhood to live through those crises, and how has it affected your life?
Well, like I said, my parents started the job. And then when I came of age and got informed about my disease, I decided to ask a lot of questions, read a lot of books, attend a lot of clubs about sickle cell. And of course, I know when pain comes, you can't avoid pain when it comes to sickle cell, because no matter how healthy you try to live, the pain will definitely come. But the most important thing is you need to know what to do when that pain comes. I try to live right. I try to eat right. I also get very attached to my prophylactic drugs like the folic acid that we are told to take once a day for the rest of our lives on earth. So we are going to be on drugs forever, until God calls us. And aside the drug, personally, when I have crisis, I try not to rush into taking pain reliefs. There are other forms of activities you can do to prevent pain. What works for me may not work for the next person, but you must develop and find out what goes for you.
Mechanism, more like,
yeah, we call it the art of pain management, at ART.
Yeah.
Once I have pain, I try to reach out to my hot water bottle. At least our hematologist, Dr. from here, has been able to teach us about using warm water therapy to see if we can heal the pain. Then try to rest and drink a lot of water before you go in for the pain drugs.
Yeah.
Drink a lot of water, use your hot water therapy, and see if you can rest. If when you rest and you get up, the pain is still there, then reach out to the hospital and get more professional help. I try not to take the drugs all the time to avoid addiction.
Exactly.
Because a lot of them make us feel very good. That's the truth. We feel high and we feel good about it. So you have to try to avoid addiction by taking according to your doctor's prescription, only when needed.
That's good. Thank you so much. Already it's becoming quite a huge conversation. Dr. Paul, I'm coming back to you now. And that would be, how can sickle cell anemia be diagnosed? Yes.
Sickle cell anemia can be diagnosed with the hemoglobin genotype.
Yes.
And they have different forms. We have the hemoglobin electrophoresis, which gives you the genotype.
Yeah.
The higher ones are more better, and they give you a lot more sensitive and more accurate results. We have the HPLC. We even have DNA molecular studies as if a baby, a neonate, you can make a diagnosis of sickle cell using the molecular diagnosis. So, but by 6 months, when the mother's hemoglobin is going up, the child's hemoglobin is being expressed, that's when diagnosis can easily be made. But if you make it earlier than that, you may not be able to
get it right. Yeah, okay. All right. So now, then how early can a child with sickle cell disease or anemia have symptoms? How early?
As early as 6 months.
As early as 6 months. So
Yes.
the child can have a symptom.
Can start having the hand and foot symptoms, that pain
Yeah.
and swelling of the hand and foot.
Okay, at 6 months. Okay. Now, what are other complications that we can have a sickle cell? And this is, you're going to go to town, because after this we'll go on a break. Then we can read out the phone number for people that want to call, and then we'll go back to Deborah. So what are the complications of sickle cell anemia? And when we mean system by system, in simple terms as you can. I know sometimes it's difficult, but
Yeah. In simple terms, as much as possible, they have pain, what we call the vaso-occlusive crisis.
Yeah.
That's part of the symptoms. That's majority one of the symptoms a lot of them come down with. They have them coming with pain. Then they can have stroke. Let me start from up. They have stroke. They can have what we call retinopathy, which can lead to blindness. They can have what we call acute chest syndrome. They can't breathe well, and it leads to death, easy death. They have what we call pulmonary hypertension. They have leg ulcers, which is also common, especially in the hemoglobin Essien. They have nephropathy, that's kidney problem. they can have kidney problem, they can have avascular necrosis of the hip of femur. You now found that they have disability, so they need to do something. They are prone to infection, osteomyelitis, septic arthritis. They are prone to infection. Well, I think that's basically all trying to go systemically. That's what they have.
Okay, can you predict who is going to have what? Like, oh, this person has sickle cell anemia, but she might not have a stroke. Or is it that anybody can develop any of these complications, just doctor?
Well, we have two phenotypes of sickle cell. We have the vaso-occlusive type, and we have the hemolysis type. So based on the phenotype, you can kind of predict that's going into more like core hematology, but you can kind of predict based on the phenotype. There are those that come down with crisis more.
Okay, than others.
Yeah, when they come down with crisis, those are the ones that have vaso-occlusive crisis. So there are those, and those ones can also have the acute chest syndrome. Then there are those that have the red cell breakdown. Your red cells will break down in 120 days,
yes,
but they are break down in 20 to 30 days. So there are those that have a rapid, yeah. So they have hyperhemolysis.
Yeah.
So those are the ones that can come down with stroke. They come down with nephropathy. They come down with retinopathy, with even leg ulcers. It's found that those are so somehow based on the phenotype and how they present, you can predict. You are not 100% certain, but you can predict which of them can come down. But with regular follow-up, by the time you do the full blood count, the monthly checkup, you can detect when there is a shift and the patient is tilting towards the complication and intervene on time.
Okay. Now, how about the cause of death in sickle cell anemia? So you've mentioned the acute chest syndrome as one of the things that can cause death in them. What are other things? You mentioned stroke and then kidney problem, kidney failure, blindness, and all of that. What is the most feared cause of death amongst people living with sickle cell anemia?
Sickle cell is a hypercoagulable state.
Yeah.
So somehow the fear of also throwing a thrombus and having a PE is also there.
That's
in
a
them.
pulmonary
embolism.
You're going to explain that. What is a pulmonary embolism?
A pulmonary embolism is a clot. You have a blood clot because of the state that they are in. That's why we call it hypercoagulable, because they tend to clot their blood clots on time. They have a high platelet, which also aggregates and form clots. So they can have a blood clot in any part of their body, the leg, and it can, what we call an emboli, that is dislodge. The clot will dislodge, move through the blood vessels to block an artery in the lungs. And when it does that, it also blocks the heart. So depending on if it's a minor or a major blockade. If it's a major blockade, it's almost like an instant death. If it's a minor, maybe showers, you can help out with anticoagulant to see the patient to come out of it.
Okay, you can call us and join the conversation or ask questions. You can ask the doctor, you can ask Madam Deborah any questions concerning sickle cell anemia, sickle cell disease. So our number is 080 94 44 40 59. I'll take that again. 080 94 44 40 59. You can call us, join the conversation, ask questions about sickle cell anemia. Okay, let's go back to Madam Deborah. Madam Deborah, I know you are a mother. I know I've seen you have kids. And I have so many questions for you, and I'm sure people are listening because a lot of people have concluded that once you have sickle cell disease, you will never have children, you can't get married. In fact, your life is upside down. First and foremost, I want you to tell us, how did you deal with stigma from people, friends, family, there's some people that will be over dramatic more than you. All of a sudden, they won't even allow you want to carry cup, let's carry cup. How did you deal with all that, the stigma, everything?
Well, funny enough, we did all the chores in the house. There was no discrimination that, you are SS and you are AA. We did all the house chores. And my mom knew where to tell us to stop. But I have been stigmatized in school. Back then in school, I didn't really have or keep friends for too long. You could be friends with you 1, 2, 3 days, they step out and they have their own clusters and cabals. You wouldn't know why. And in relationships too, I've been stigmatized where, okay, let me go personal. where during my divorce case, my petition read that I have paralysis, and it took me to get a medical report that I do not have paralysis, but rather I have sickle cell. I've also been in a relationship where we went on and on and on, and while getting married, funny enough, the lady is even a pediatrician, consultant pediatrician, and she was one of those that believed I wouldn't make it through childbirth, and said she wouldn't want her brother to be a widower at an early stage. But guess what? The brother dropped dead 2020.
Wow.
And I'm still here with sickle cell and I haven't dropped dead. So I think you handle the stigma. I think you just make up your mind that these things are going to happen. People have HIV/AIDS, have cancer, they have diabetes. They can't be stigmatized. So why will I be stigmatized because of something I inherited from my parents? 2 weeks ago, I made a post on Facebook, and a young man that was actually following around me when I was a child opened up on Facebook and was like, he thought I was an Obanje, and that was why he ran away. So I got to know that my childhood boyfriend left because I was an Obanje 25 years later. He just mentioned it to me, and I was like, wow. Now I don't know how to forgive such a person because I thought I had done something wrong. But because I was always fainting in school, I would step out and fainting, my eyes were always yellow, so he concluded she's really an Obanje. I came from my schoolmates, and I'm getting to know this 25 years later. And I had to post it there and tag probably all my schoolmates who did that to me. Surprisingly, not one person responded or commented because I'm sure they felt very much ashamed.
Yeah.
It still affects me today because I can't really. I'm on my alma mater platform, but I don't get involved with them because I was once stigmatized by the same people. And today I'm alive. You expect me to come out and join programs? No, I wouldn't. It's going to take time for me to come out of that stigmatization. But back home, thank God for my exposure, my family's exposure. We were never stigmatized. As a matter of fact, I was doing my sports.
Wow.
I was playing volleyball when I was here in Unical and Malabo until I found out that the frequent shoulder pain and wrist pain were from volleyball. So I stopped, So I had to cut down on a lot of sports because I found out that the older you get, the weaker you become. The bones cannot be the same again. Sickle cell or no sickle cell. So stigma works, and most importantly, I'm not ashamed of attending my psychiatric clinic. The mental health clinic is very important for those living with sickle cell because that's the only place you can hear your doctors tell you that you are like every other person. You are a normal person but a different blood type. Like Ofonime said, different red blood cell, but you are normal. The same God created us, the same God, and most people, look, we can have sickle cell live as 90, 98 years old, and those who don't even have sickle cell die in their prime.
Exactly.
So I get very close to my psychiatrist when I get disturbed about one thing or the other because I'm being stigmatized. Like in church, last week we were to have a program and somebody stood up and said she won't be able to do it because she's going to fall sick. And I said, wow, okay, I'm going to do it. And I did the program to the end and I did not fall sick. But I took it up as a
I
challenge.
don't understand. Somebody actually says you're going to fall sick.
Yeah.
Like how? She predicts that you're going to be sick.
Yeah, because we are sickle cell, SICK, so we always fall sick. That's their belief. That's how they define sickle cell, those that fall sick all the time. But we have people that stay 2-3 years without crisis. So I think it's not always the best to stigmatize people. It actually affect their mental health.
Exactly.
But you can't. There's only very little you can do.
You can do about
to stop
such,
people
yeah.
from
People are
stigmatizing
entitled
you.
to their own.
So you have to make up your mind.
Exactly.
I do a lot of things to make myself happy. What the doctor will say, what that makes you happy, and that's I do it. We're not supposed to place colored hair in the hospital. But I did it because that's what's going to make me happy right now. I've been moving. So if I'm going to make colored hair and it makes me happy, stabilizes me, I don't have to fall sick, I will do it.
Exactly.
I'll do it. So we can live above stigma once you make up your mind to do it.
Yeah, thank you so much. Then I want to ask you, what do you think makes people stigmatize against people with sickle cell disease? What do you think? Can you hazard a guess? Like, why do you think they would do that? Because it's not a communicable disease. So, I mean, what's your own? Not like I'm going to come near you and I get it. So, why would you stigmatize someone that has sickle cell? Why do you think people do it?
It's ignorance.
Exactly.
It's ignorance. Sickle cell is not really talked about in our society, unlike HIV/AIDS. It's not a ringtone in the ears of the government. That's partly because they're not making money from it. And it's a black man's disease. So they feel like a doctor a pathologist in Benin once called us a pure water sachet. Users, when the water is empty or when they're going to pray, the fling goes on the streets. That's what he said, and he's supposed to be a pathologist. So once people are not exposed about something, they are not knowledgeable about it, they can afford to say anything they have to say. That's why we keep speaking about advocacy. Like you have a radio program, it's also a form of advocacy.
Yeah.
For listeners out there to know that you don't have to stigmatize people living with sickle cell. As far as I'm concerned, there are things I can do that one who has AA will not be able to do it. We have a lot of stamina. I don't know where it comes from, but we have stamina more than any other person. So once people get to know much about sickle cell, they should long for this knowledge. They shouldn't feel because we are all AA in my family, or probably I'm married to one who's AA, so I don't have to know about SS. You may come across one who is living with sickle cell. You may have somebody that will have somebody else that has sickle cell, and the person will want to borrow some knowledge from you. Use the internet. Ask your doctors. Get involved in clubs. Get involved with networks and learn. Let's not just be chatting and watching news with our phone. Get on the internet and read about sickle cell and help the next person around you.
Yeah, you got it right. I think ignorance is a big factor, because if you have enough information, you will not stigmatize.
Yeah.
Okay, then another thing I want to ask you is, what was your journey to motherhood like? That's what everybody wants to know. How was it? Was it worse? Were your crisis more? Did you have? How was it generally? If you had to do it again, would you still go for it?
Well, let me start from the last question. If I have to do it again, yes, I would go for it. But according to Dr. Yama, don't try that again. That's what you always say. But motherhood is fun. My first pregnancy, I didn't have any crisis. I actually wanted to have a normal delivery, but my gynecologist advised against it. Because my sister who stays in the UK, she's Essien, and she had 3 boys. She has 3 boys, and all through normal deliveries. But of course, we can't compare the health system that of Nigeria. So I had my first pregnancy crisis-free for 9 months, but crisis came afterwards because I think my lecturers were dropping or something of that nature. Second pregnancy, I didn't have any issues till 7 months when I had developed this low oxygen, So I was placed on bed rest, and I still had my baby, and I carried both pregnancies till full term, 9 months. So I didn't have any issues at all. So pregnancy is fun. Anybody has the right to get pregnant. You wouldn't say because you are Esther, you don't have children. Anybody can die in the labor room. But you keep very close contact with your doctors when you're pregnant.
Exactly.
Because it's very risky. It's one of the leading factors of death when it comes to sickle cell. So be very close to your doctor, because I attended 2 clinics, my hematology clinic and my antenatal clinic. So I was in the hospital almost every week. So at the point when the doctors knew that this woman is really serious, of course they got interested in my case and they helped me through it. So they have to get close. Don't go getting pregnant and going to traditional bed or going to the church to give birth, because we have such people, even with sickle cell. Always get to the hospital. And I registered for my antenatal from 3 weeks of pregnancy. So I felt awkward coming to the clinic with a flat tummy. People looked at me and I was like, God, I felt ashamed. When it started coming out, I felt encouraged. And I was attending my clinic every 2 weeks because my case was different. And I had fun. I enjoyed it. So breast for my doctor, I think I would have gone the 3rd time.
No, they say no, don't do that. Okay, Dr. Ofon, we're back to you now. So, what would you say about pregnancy and sickle cell anemia for the woman?
Well, thank you. Pregnancy and sickle cell is a high risk.
Good.
So, as she said, she was close to her doctor, very close to her doctor. It is a high risk in terms of crisis. Pregnancy is the hypercoagulable state
Already.
Sickle cell is a hypercoagulable, so you're like putting fire on
top of fire.
So you expect more.
Yeah.
So it's a high risk, even for both for the mother and for the fetus. So it's a high risk. So it requires close, careful monitoring. But however, they still do well. We have a lot of them that have babies.
Okay.
They have children and they have carried their children to term, giving birth through we don't normally the teaching now, in those days we didn't really advocate for spontaneous vaginal delivery. But now I think it's allowed for them to have spontaneous vaginal delivery just by obstetrician assessing them and seeing
that they're fit for that.
Yes.
Okay. But are there any groups or like a specified thing that will happen and you say, oh no, you might not be able, you shouldn't go through this? Is there going to be anyone like that, like because of maybe some complications that the pregnancy would not be advised?
Well, like every other women, they tend to also have eclampsia and preeclampsia, which is normal for every. So if we have that, you want to terminate the pregnancy, not terminate but remove the baby. And they also have some of them tend to have difficult pregnancy, especially those that have bad obstetric history.
Yeah.
Taking the miscarriage, they have the first or second trimester. So once we have that have the sickle cell that has had a bad obstetric history, we don't want her to have a spontaneous vaginal delivery. So we want to intervene maybe at 36 weeks. We didn't even want her to cross over at 36 weeks. We are sure we want to intervene and bring out the baby. Then those that had difficulty throughout the pregnancy, we had some that were back and forth hospital admission, almost on weekly or transfusion dependent, pregnancy anemia and all that. We also don't want them to go further than 36 weeks. Once 36 weeks, we are sure fetal maturation, one section of pregnancy.
Okay. So now there's another thing. People say, the people that have people living with sickle cell appear sickly, sometimes look pale and all that. People need to know why they shouldn't be given blood tablets, because some people think it's just easy. After all, if my blood is low, I go and buy it. Why is it not for them? Why do they do folic acid instead of iron? Yeah.
One, let me correct the misconception. They don't look sickly. Have you seen them now? They are very hot people now.
Have you seen Deborah? I don't even want to talk about Deborah. Is a different variant on her own.
So they don't look sickly. This generation.
Honestly, Deborah is something else.
Yeah, so that was on the lighter move. But in all honesty, if you look at them, they don't look sick.
Yeah, especially those that actually take their care and their hospital visits seriously.
Yeah. So sorry.
Yeah, I was asking why they do folic acid.
So why we don't give them iron is because, as I said, our red blood cell break in 120 days.
Yes.
They have this 20 to 30 days, which is a lot faster.
Very rapid.
So when red blood cell breaks, iron are released. Iron doesn't have a way of being excreted
From the body.
So it stores inside the body. So by the time already they have iron, and you keep adding, you now give another iron. You're adding on top of iron, and iron will now penetrate into the organs. That's where we now have hemochromatosis.
Yeah.
We now have the liver, the heart, even the skin, diabetes will come in. So that's why we don't advocate for iron, except proving that this person has iron deficiency based on the laboratory tests.
Yeah.
Then we can now give you iron.
Okay.
Some of them tend to also have iron deficiency.
Really?
Yes. So we can now give you iron,
Okay.
but you cannot on your own
Just go buy and take.
come down to bite you.
Exactly. All right. So we have a WhatsApp message from Miles from Unical. So Miles says, "Good evening, Dr. Thelma. Please, do someone outgrow sickle cell?" So this will be for Dr. Ofonime. Because I could remember my parents telling me that I do get the attacks when I was younger, but since coming of age, I haven't had any attack yet. So where do we put that? So far,
No, because you cannot outgrow.
okay.
You don't have, that's like saying the inherited thing, you already have it. So you can't outgrow it. But you might be lucky to have some things that what we call ameliorate the crisis.
Yeah.
Your hemoglobin F might be high.
So that's a fetal hemoglobin.
Yes, fetal hemoglobin might be high. So it ameliorates some of the crises that you have. And some you might have some genetic things, like even the thalassemia I mentioned, you might not know. You might have it with cohabiting co-inheritance with the sickle cell. And that also tends to ameliorate some of the crises. So you might be going free. But that doesn't mean you shouldn't go to the hospital and do a test
Exactly.
and check yourself up.
Exactly.
You might be working today and you don't know what is going on internally.
All right. So I'm going to let's talk about our topic. Love is not enough. In the context of that, what does that mean in relation to sickle cell? Because you said in Africa, Nigeria is still topping the chart, meaning we're not doing something right. And after what Dr. Deborah has explained, she inherited it. She was helpless. We don't want to have many more helpless people. I mean, not everybody is as strong as Deborah. She's a fighter. Her own is just she's different. So leave all this sweet talk. I mean, that's her. I've lost a friend from sickle cell. She died after graduating from the University of Calabar. We were friends from secondary school. And I know how her death hits me. Like, it hits me in the bone. So I know the pain. I also have cousins who had sickle cell. They were about 6. And they all died one after the other. And the other day, my mom was just talking about their mom. She called her and she's just alone. she lost almost all of them. Okay, one was a pharmacist, she died. Yeah, so something just happened. So love is not enough, and that context is we're here for advocacy, like Deborah said, to tell people not to stigmatize against people living with sickle cell disease. I mean, they inherited it, fine. But then how do we put an end to this?
So like the only prevention is genetic counseling.
Yeah.
As we have said, you inherit from your mother. So if your mother is AS, your father is AS, the likelihood, that's why it's a probability, it's not a certainty. The likelihood of one out of the four having hemoglobin SS is there. So what we advocate for is please do your genotype before marriage. I'm sure most churches now do that. Do your genotype. That's the only way we can prevent it. Because I'm not going to advocate for abortion. I'm not going to advocate for prenatal screening, which is there. But if you now screen and you found that this child is in SS, what next? So the way I can advocate for it, prevention.
Yeah.
So do your genotype. If you're going to get married, please and please and please. It's as important as anything. As buying your wedding gown.
Exactly.
It's as important as paying your bride price to do your genotype. Because, as I said, love is not enough. When you have one, talk less of two, talk less of three, HBSS, you are back and forth hospital. You find that love might be that.
Yeah.
The man will get, frustrated. Finances are being going. The family time is not there. You can't, it takes a enlightened, understanding parents to keep pushing. And that's why some mothers that have sickle cell patients are not at home with the parents, with the father, because the marriage will suffer. So to prevent all that, prevention is the cure. Yes, so please, your genotype is all we are praying for. So go for genetic counseling. Go to do your genotype in a reputable laboratory. Because my people have actually told me, doctor, my genotype.
It was AA.
It was AA. My husband was AA.
Exactly.
My husband was AA. And yet, we're having a sickle cell patient. So how? Please do your genotype in a reputable establishment.
Exactly.
So that they can know.
Okay, Deborah, can you weigh in on the love is not enough? Because that theme was specifically picked because that's the only way we get sickle cell anemia. Someone has got to have the two AS has got to come together before this. So, people now, I love her so much. I cannot live without you. In fact, I'm dead if I don't marry this person. And at this point, when you have a child that has sickle cell anemia, that's when the realization that, look, that love has been put to a mighty test. And it's not just both of you now. It's another life who didn't ask to be brought into your love drama. So please, I want you to talk about it as someone who's living with it. Maybe during our parents' era, those things were not common. We couldn't get a place to do genotype on time. But right now, it is with us everywhere. Well, we're not talking about the ones that are just on the streets we don't know how verifiable they are. But we have good, reputable labs. We have teaching hospitals all around. So please weigh in on this love is not enough.
Like Dr. Ofonime said, you may fall in love with someone today, probably AS, and I think sometimes also AA and SS. You feel you're so much in love with her and all that. Sometimes AS and SS want to go in and they're like, we can cope, we can do this, we can do that. Once one crisis hits, it's the mother that suffers. As I said, we see them in the hospitals. At the end of the day, the man will run away. And you're like, some educated man will tell you, you gave this child this sickness. You brought this child upon yourself. Some of them will actually threaten you before marriage. That look, if you have a sickle cell child, I'm going to walk away. Because sometimes the society makes us feel that it's the woman that is desperate to stay in the whole marriage thing. So if you're a woman and probably you don't check your genotype and then they want to get married, you need to think twice. Because this love that is like Romeo and Juliet will turn to bitter hatred at the end of the day. Sometimes the man won't even support you financially. He will like, I'm wasting my money. But we have a parent that brings the child to the hospital, and whenever the child is sick, she doesn't tell the dad. She rather call us and like, please don't tell him, because if he hears that this child is sick, he will throw us out of the house.
God.
So she kind of tells lies that the child is with the sister or she's on holiday or something. Meanwhile, the child is in children emergency. Until the child gets well and then she goes back home smiling. Those that's a couple that of course they want in love with themselves. But because one child has sickle cell, that's it. Again, it tells on this child psychologically. You have a family of 3, one person has SS and she's like, my father said I'm not his child because he doesn't have SS, the mom doesn't have SS, the other 2 don't have SS, and then you are now saying, look, you're not my child. So she now seeks for help outside, and whenever she's sick, the mother advises her to leave the house. Go and stay with a friend or with my sister somewhere. When you get well, you come back. It tells on that child, and that pushes a lot of them into lots of social vices. They go into addiction, they go into prostitution just to survive. Because my father had to maintain my parents' marriage. And at the end of the day, the child turns around to hate the parents.
Exactly.
We have a child that had stabbed his mom in the hospital. That was in Lagos. Because if all this pain is so much, you brought this upon me, and then the mom just sat there and he picked the syringe and stabbed the mom. Of course, what can the law do? Nothing. It was provoked. He felt he was tired. You brought this upon me. I'm always in pain, and you sit there, and you and daddy are always quarreling because I'm the one that is sick. He stabbed the mom to death. And he chose to stay that way. So it tells more on the child. So I think we should be wise. In as much as we are preaching love, 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 we should be wise and think of the unborn child.
Thank you very much. So that quickly brings me to you and the Sickle Cell Club, Calabar. I know you're the founder of the club. I want you to tell us why did you found this club? What made you think about it? And what are the goals of this club? And is it open for people that are not living with sickle cell, or is it just for people living with sickle cell? What are your dreams for this club? Quickly before.
Okay, fine. We have several other clubs in Calabar. We have the Calabar Sickle Cell Foundation, which I founded, and then we have the Sickle Cell Support Network. I'm also a member, and I was past president. You know, we have my passion towards opening up the club was I lost my parents quite early. I would have given up on life if I wanted to, you know. And we're 4 of us. And I lost my brother on our birthday. He also had sickle cell, and I turned around. I'm like, come on, there's nobody helping, and I have turned out this good. It's only by the grace of God. Now, how about those who are not opportune as I was, and they are dying off? I mean, I've had kidney, urine retention, and hematuria as a child, and I've survived here. I didn't have to transplant, you know, and I just developed some funny symptoms. I've had some complications of sickle cell, and God has still kept me. So if I cannot do exercise, I cannot, there are forms of advocacy. If all I can do is talk. So let me use my God-given talent to talk to people about sickle cell, to help them. If I have some connections, let me not just use it on myself. Let me help to keep as many lives as possible still living well on earth. So that's the passion that drove me to that. And again, it's open to everybody.
Okay.
AS, AA, the doctors, the nurses, parents, friends, family members. Anyone is free to join any of the clubs. We all work as one. Yes. One particular club could be out to raise funds, the other is into advocacy, the other one into welfare. But we work together for the good of warriors in Cross River State. And one of the goals is to ensure that we get prompt care at any point in time we need it. That's 1. 2, we also ensure that we are given the right to live. We have every right to live like every other person. So whatever it takes to live, whatever it takes to stay alive, we have to do it. We have the right to access drugs. We have the right to access medical care. So we ensure that everybody, one man falling means the whole team is down. So we work as a group to stay alive.
That's so beautiful. Thank you so much. I love your passion, and I'm totally in support of the club. I think I have to come and join you guys.
Please do.
We all have to fight. There is no enough time. This topic is too big. But Dr. Fong, before we go, just 2 seconds. How can people living with sickle cell live near normal lives? Okay. Why I say near normal is because she already said no matter how you try to be fit, something crisis there. So that's why I said near normal. So how best? What food items? What can they do quickly before we go?
Well, food items, we don't restrict them from any food. They can eat anything. Okay. Exercise, you must exercise. Let it be very mild.
Minimal, something you can tolerate.
Yes. Then water. She knows I always say water. Water is a therapy. Drink as efficient as possible. Eat well. Your folic acid, your routine medication. Then we have a drug area. which increases the hemoglobin F,
Yes.
which is being updated. And I'm sure it's almost like a routine medication now for sickle cell patients. So we tend to give them, and they do well. It reduces the frequency of cry that they have.
Yeah.
So, and just live well, enjoy your life, go to school. You know,
Yeah, you
when
can-
the crisis come, you step in, we treat you, you go back to
Exactly.
life. You know, they live normal life, and I believe they do well. We have doctors, we have lawyers, we
Yeah.
have
We
engineers,
have
we
people like
have
Deborah.
we have academicians.
Man,
It doesn't restrict a child from being
who you want to be, so you can go pursue your dreams and get
We
it.
have governors,
Exactly.
models.
Of course.
Yeah.
Governors.
we have politicians that
Yeah.
are there. Yeah.
Exactly.
So please, mothers, fathers, do not be ashamed. Do not restrict your child. Do not put her in the house and say, no, let people not see you. Do not stigmatize.
Yeah.
Assist that child as much as you can within God-given ability that God has given you. And that child will come out to be a warrior,
Yeah.
like every of them are, and a success.
Yes. Thank you very much. Deborah, any last words? 1 second last word.
Yeah, just one last word. If you have sickle cell, try to be intentional about your health. Do not be ashamed of who you are. Stop hiding it. Like one young lady asked me on Facebook, are you sure you have sickle cell? You're not ashamed to say it.
Oh my
Did
God.
I steal? So please, let's stop hiding, because when you hide, the more you hide, the more you kill yourself.
Exactly.
Because no matter what, I know too much about you, you're going to get depressed. Seeing another person coming out and getting very happy with herself, you are depressed and confined in one place. You start getting very bitter with everybody around you. So let us live right. Do whatever makes you happy and stay close to your hospital.
That's beautiful. Thank you so much, listeners. This show has been packed with information, knowledge, and everything. I want to thank these beautiful women, Dr. Ofonime and Deborah, for coming. You've been a huge inspiration to me. Thank you so much. And listeners, remember that you don't have anything except you have good health. So till next week, Wednesday, we'll come with a very interesting topic. I want you to keep it locked on 103.5 Medical Radio International. Thank you so much and have a wonderful day.
Medical Radio International, Entertainment 360, Edutainment 360, Infotainment 360. We smile like that.